So how do you prepare? Again, I talked initially about knowing what the topics are. You can consult the PLAB blueprint, which is available through the GMC website. Obviously, I'm just going to say or put it out there that there are a lot of notes floating around. There's a lot of, covering vast, topics, covering all the real cases. There's lots over there, right? I'm not going to tell anybody that they shouldn't read those or that they shouldn't go through them. It's a good idea to have an overall idea, but please don't obsess over them. Don't try to memorize them. As I said earlier, that's not a good idea. Okay, choosing the right course is really important. You want to make sure you do your homework before you choose your course. Make sure that they know how to approach the stations, they know how to adapt. They should not be a one size fits all. If a course is promoting a one size fits all, that's a big red flag. Okay, because they need to be cognizant of the fact that there are so many different types of cases. Just for an example, there's different approaches to LGBTQ cases, which many candidates are flustered about, which they don't know. What are the adaptations they need to make? Women's health, what are the adaptations? Men's health, angry patient, breaking bad news, inappropriate, medical error, for example, suspecting a non-accidental injury, for example. How do you change? What are the different things you need to be mindful of before you actually deal with these? So remember that there's no one size fits all. You really need to have a course that tells you about all the different types of scenarios and how you adapt. Please really don't underestimate your IPS skills. There should be very clear understanding of what IPS skills you need to develop for this exam, and not just for this exam, but I say beyond. One of the things that makes me a bit sad is when candidates come and they say, Dr. Sara, I've become Dr. Sara after 17 years because over here in the UK, you're called by your surname. So I've been Dr. Awan medically, professionally, but then my lovely students call me Dr. Sara because in Pakistan we call each other by our first names. So that's fine for me. And they say, Dr. Sara, you just need to get us to pass this exam. Like, bas humne exam pass karna hai, and that's it. For them, that's the end. You just need to teach us the skills. We need to pass the exam. And that makes me sad because I feel that you haven't truly understood why this exam is important. It's just the first step of the rest of your career, inshallah, in the UK, in the NHS. And all of these skills are going to help you. They're going to serve you. You can't even imagine how important these skills are. They are for the rest of your life. So when I'm teaching my students, I digress into ways that I say that, look, what I'm telling you now is not just for PLAB 2, it's for your life. How to avoid complaints from patients, how to minimize the kind of miscommunication or misunderstandings, etc., etc. So please be mindful that these skills are not just ending at your PLAB 2. That's just the start. Please incorporate them into yourselves, all your consultations, and they will really serve you well for the future as well. Management, super important. How do you discuss management? Please make sure that your course provider really knows their management and they give a lot of importance to management. Again, it's a red flag if a course is saying that management is not important, just data gathering and interpersonal skills is enough to pass you. That's a big red flag. Smaller groups, please try to find a place where you can really focus on the quality over quantity. Unfortunately, some providers are very commercialized, and I've had a candidate who said to me it felt like a fish market when I went there. Nobody is talking to anybody. You can't, even though there's so many people there, you can't really find proper people to practice with because everybody's got their own little groups. It's impossible to get hold of the manikins. It's really hard to kind of do anything. So make sure that you get what you need. Notes should not be overwhelming. They should really be, more kind of easier to understand so that you can properly digest them, you can learn, you can revise, and really understand the message or the essence rather than just learning up things by heart. Make sure that the manikins wherever you go are really good and you can actually get the chance to practice. I've heard stories where students have told me that they're literally timed so they can check out a manikin and they're timed and within 5 minutes they have to return a manikin or something silly like that. And that's just unfair because you should have all the time you need. Again, the SIMman and METI point is that please make sure it's not just a doll that you're practicing on. Some places just have an inflatable doll, which is really, I would say, not like the real experience at all. You really want to be able to get a good practice on there. And just make sure you get a lot of practice. A really good idea is to have supervision, senior supervision, where you can get good quality feedback. Because sometimes groups of friends, they think they're doing all right, and actually they're just on the wrong track, but they don't know because no seniors given them proper feedback, and so they've just put together what they think is a good idea, and so they're doing it that way. So make sure that you have all of these things, and of course, mocks are really important as well. Sadly, some providers, they're just asking PLAB to candidates who have not even passed the exam yet. They've literally just completed the exam and they say, okay, look, we'll pay you at some very nominal rate. They're not supposed to even be working. And they say, can you just do the mocks? And so those candidates are simulating and they're also examining. Now, the issue with this is that those candidates have never worked in the NHS. They're not practicing NHS doctors. They literally are provided with a tick box, which they need to go through. And they can't really give that quality feedback because it's literally just, again, in the box. And it's not very reflective of the real exam, because in the real exam, you have real consultants, GPs, doctors who are working in the NHS and who would be assessing you accordingly. So it's an important thing to make sure that you have some senior examiners and good quality simulators as well. I think it's important just to mention a little bit about us because many people do ask us, who are you? What is MEDASTRA? Well, I've told you already, I was doing this informally for many years, but more recently we've started doing this more formally under the name of MEDASTRA. We are situated in a lovely part of Manchester called the Curry Mile. And so we have lots of desi food cuisine, not just desi, not just Pakistani, there's Indian, Turkish, Iranian, Kurdish, I mean, all the cuisines, right? And we're very close to the GMC. We thought it was a nice area because, you're less homesick that way. And, if you go out at 2 a.m., nowhere else in the UK, do you see so much, as they say, halla gulla and raunak as you see over here. We really, really focus, alhamdulillah, on our students. For me, it's just not about money. It's about the fact that we're doing it right, that we're prioritizing you, and that you are getting all the support that you need to pass this in the first go, inshallah. We have a variety of courses, just trying to, again, suit people's budget, suit people's needs. So we have the full course, which you'd probably want to do if you've not done any other course. We have a crash course if you've done somewhere else and failed and you just want to get an overview of approaches. Practical skills, which is just your examinations, your procedures, the METI, etc. We also, alhamdulillah, pride ourselves on the fact that our students become part of the MEDASTRA family. So we don't just cut ties with them. We continue to support them for free. So we have something called the post PLAB group on WhatsApp, where we add our students who passed the PLAB and we help them with attachments, jobs, CV writing, interview skills, all of that. So alhamdulillah, we've had quite a few students, and I would say that alhamdulillah, we've not needed to market so far because our students have been our biggest advocates. They believe in us, they've seen the difference, and they've really told others about us. So alhamdulillah. Our last crash course had 100% pass rate. So just to put it out there, we've alhamdulillah had really good scores. I'm sorry, I just put this in here because I didn't know what else to put in here. This is just an example of our kind of mock. This is our post mock discussion. We give individualized feedback on the station. So that picture where there's lots of people. We have British simulators from the local population just to really give you that training and that idea of what it's going to be like in the real exam. Because I have so many candidates who say that they did really well in their mocks at other academies, and then in the exam they froze because they couldn't understand the accent or they'd never spoken to a white person before. So we try and really give you that experience as well. We have senior examiners, consultants, GPs, etc. We do not keep any PLAB candidates as examiners. We also do something called supervised practice sessions. So I personally, or one of the examiners or one of the senior doctors tends to supervise you when you're practicing, so we can really give you the quality feedback. This is apart from the mock exams. We also get a talk from a PLAB examiner who comes in and tells you a lot about, exam do's and don'ts, which really helps candidates to understand things from a PLAB examiner perspective. We also have limited accommodation on site. This is sort of our crash course that has just gone on. My students are right now waiting outside for me to start the supervised practice session. Sorry, just ignore the bell. I think that's one of my students turning up early. And we just do whatever we can, to be honest. And I would just like to share here our approach. So this is a very, very small example for you of what we provide. Now, I don't believe in hefty notes. I don't believe in overwhelming you. Students already have access, like I said, to all the notes from all the other places. I have worked really, really hard personally and with a small team of really experienced senior doctors as well as examiners to develop these flick cards. Now, why I call them flick cards? They're quick flick cards because they really will help you with your revision. Okay, and I've done it in such a way that you could actually get the essence of your cases from a PLAB 2 perspective. So I've not gone on lots and lots of theory about a case. I've really honed it down to what you will be looking for in the PLAB 2. So just to give you an example, this is my quick flick on chest pain. Now, again, as I said, please don't take any pictures. This is copyrighted material for MEDASTRA. These are just for the purpose of our course, but I just want to give you a flavor, if the students are wondering. So for example, this would be an overview of data gathering. Now, the first thing you want to do is, obviously, we're not putting here about introductions and greetings because that's all going to be covered in the course, how we go about those things. We're not just talking about how to prove chest pain. Some people say, why chest pain? Because in other academies, they have it as PE or MI or angina. But the patient is going to present in the exam with chest pain. So I want you to be thinking right from the start of how do I diagnose what this chest pain is? So you start with exploring the pain in these different ways. Again, in the course, we explain to you how to verbalize these questions. So for example, how would you verbalize about the site, onset, character, radiation in a very patient-friendly way? And then I've put for you the different differentials. So these are the more serious cardiac causes or serious causes. And I've put for you a description of what you might expect to find when you ask those questions in history. So it's very, very focused for the PLAB 2. Why are you asking? People have these tick boxes where they just want to ask these questions, but they don't know why they're asking it. So I've given you all the reasons of why would you want to know this? What is the relevance of these things? Okay. Again, management, I've put it, I think Omar asked this question, how do I know what the flow is of management? How do I do it? Again, I've put these things here for you. For all the different kind of presentations, these are the different things you might want to do. Then the thing that makes us really different is we've put examples of how you might want to verbalize things in management, because this is where students really, really struggle. How do you verbalize that management in that short time? So Umar, this is the kind of example I was talking about, that if you had to explain PE to a female on COCPs, this is the kind of verbalization that would be very quick, over in 1.5 minutes, and it would cover all the essentials. Okay, so that's essentially, do I have time for the CV?